I came to Fox Chase Hospital to get a bone marrow transplant called an auto transplant, which was using my own cells. That transplant worked and kept the cancer at bay for 18 months, and then it came back, and so it was suggested to me that I have an allo transplant, which is using a donor for the stem cells.
Being an oncology nurse, I thought I would have handled the diagnosis a little bit better, but of course being a wife, I was more scared, the unknowns, what would happen. I knew that mantle cell was an aggressive cancer.
John Farrar had a donor transplant from a matched unrelated person. That's an extremely complex modality because it involves another person's immunity coming in to substitute for your own immunity.
My husband did very well at the beginning of transplant, but then we had some post-transplant complications. He ended up developing bacterial pneumonia that went septic. We were life-flighted down here the beginning of November, where he remained in the intensive care unit for 30 days on a ventilator. My husband, when he first came out of his coma, he was barely moving anything. He was unable to get out of bed.
He had to have a call bell that he could blow in because his hands, he couldn't even lift his hand. Tubes. And, just to see John and Jen like this, was heartbreaking to the whole unit.
I really needed physical therapy because when I woke up and I was like, I can't move my finger or my hand or anything, that was a bigger shock than, I think I was more shocked by that than when I found out that I had cancer.
The problems that our patients have extend outside of just them being sick in the hospital. It takes everybody and everything, and inside the hospital we can only focus on the patient, so we have dedicated social workers who reach outside of what we can see.
Social workers have to be expert in understanding the dynamics of how illness impacts both the patient and the family and the caregivers. Also have a good knowledge of what resources are available and aren't available, and understand how to work as a multidisciplinary team.
We can only get them to a certain level, and then they needed more support outside of us for the rehab.
The only problem was that our insurance did not cover it. How could I afford that? I still have kids. I have a child in college. I have a child in elementary school. I'm not working because I'm in Philadelphia. And it was for Carve for Cancer, who, Linda, our social worker, who was amazing. Social workers are so very important, that got us some help through Carve for Cancer, and we're really grateful that we were able to get some help.
For him to be able to go there and get the rehab that he needed, and now to live his life, it's just unbelievable. And we could not have done it at all without the support from them.
Through physical therapy and through my own determination, I am now walking even without any assistance with a cane.
Carve for Cancer is, if you look at what they've done, what we've done with their money, it's life-changing for a lot of patients. Patients are at their wits' end, the families are at their wits' end, and to come through with being able to pay their utilities, being able to pay the transportation back and forth, being able to house them for a week at a time. I can't tell you the gratitude some of these patients have. It just makes us feel like we've comprehensively taken care of the family. We haven't just treated the illness.
I would just really like to thank Carve for Cancers for their impact and what they do on our patient's life and our whole unit. It's a gift from God, and we really appreciate it.
I just want to thank you so much for your generosity.
I would really like to thank Carve for Cancer for helping me out.
I would like to thank Carve for Cancer for helping my husband go to rehabilitation. If it wasn't for the rehabilitation, I'm not sure where we would be at this stage in our journey. But I would also like to thank the contributors who contribute to Carve for Cancer. This is a huge service that is provided to, not only myself, but other cancer patients. And I really feel that this is probably one of the best things that you can contribute to. And I just want to thank you.